This is the NEU's weekly report on COVID in schools, although we had last week off for half term. You can see on the ONS random sample that cases are starting to rise, and at the sort of rate they were rising in September, although the level is currently still low. And you can see that it's low in almost all the English regions and in Wales, but in the northwest there is a very sharp increase. When we consider school-age children, you can see that primary-age children, age 2 to school year 6, are at more or less the average for all ages, but secondary children have picked up. The slight decline is for half term. But age 2 to school year 6, 1 in 380 children have the virus, the same as at the 17th of September last year. Secondary children, year 7 to year 11, it's 1 in 210 children, the same rate as at the 26th of September last year. The graph that we have here, which is a log scale graph of PCR tests, so this isn't the ONS random sample, this is people who've actually had a positive test, and the straight line there indicates that the virus is growing exponentially again, despite being at a low level. It is increasing exponentially. And the R rate is in all regions, almost all regions, above 1. There are just a couple of regions where it might be at 1, so the increase is fairly uniform. And we can see here that there are actually now starting to be significant differences between some districts. And each line on here is a different district. There are 113 districts with a rate over 50 per 100,000. And there are further 35 districts with a rate over 100 per 100,000. Despite all this, hospital admission rates continue to be low. Although on the log scale you can see they have started to increase. But as well as hospital admission rates, there's also the question of how they're distributed across age and how long do people stay. There are two sorts of data on this chart. The red and yellow jagged lines are showing the daily admissions, and you can see we're at very low levels. There are different age groups for each different colour, but we're at very low levels. The line graphs, the light blue, dark green and light green graphs, are showing what proportion of the hospitalisations belong to different age groups. And I think the most significant thing on here is the blue line is showing a huge decline in the share of hospitalisations of those aged 65 plus. And that's obviously because they have had almost everyone in that category has had 2 doses of the vaccine and sufficient time to build up antibodies. Do get your vaccination, it's working. And because of that, people who now go to hospital with COVID are much less likely to die than previously. The yellow line at the bottom on the right hand side is much smaller than the yellow bits on the left hand side. And you're also much more likely to be released from hospital after only a few days. That's the light blue line, shows when people might be released. We think that's for 2 reasons, that the older people have had that double vaccination, and that even for younger people, a lot of them have had 1 dose, and that does seem to be meaning that even if you get COVID and get to hospital, you still get out, you get better quicker. And all of that means that the death data continues to be very good, although obviously every death is terrible. But the death graph is still down where it was during the summer. And on the log scale version of the graph, although there's been a little increase recently, it's fallen away again, and that's very good news. Now, there are other consequences of letting the virus grow again besides health. There's also the question of children having to self-isolate and to miss face-to-face education, and the next few slides show that. So this chart shows the number of school outbreaks, and it shows that they are increasing again. Not anywhere like where they were in the autumn term, but in primary schools there were 31 outbreaks, that's 1 in 570, And in secondary schools, 48, that's 1 in 90 secondary schools had an outbreak. An outbreak is 2 or more cases of the virus. So we have to make sure that we don't get deaths and hospitalizations increasing too fast and we have to spread vaccination and delay reopening till vaccination is properly in place. That's the balance that we have to look at. But we also have to worry about face-to-face education. This graph shows school attendance. It's a bit hard to judge this because we're getting the effect in secondary schools here of some year 11 and 13s being on study leave, and we think that's part of this decline in attendance here. But it is something we're going to come back and look at. In the autumn term, we could see that attendance really deteriorated in November and December, and we're worried that we might start to see some of that if cases grow too fast in schools. And on this chart, which is showing the number of people self-isolating in the period just after opening on the 8th of March and the period after the Easter holiday, you can see there were a lot more in March. Cases were high, but you can see that since Easter holidays, the cases have been picking up. The number of children self-isolating is also increasing. And in the last week, we've got a number for you. It was well over 100,000 children were having to self-isolate. The real worry that number will start to increase. And there is a warning about this because there have been very low attendance in Bolton and Blackburn with Darwin where cases have been high. And you can see here 21% of primary children in Bolton absent, 31% of secondary children absent. The same sorts of figures in Blackburn. And we know that this has discriminatory effects. This is a chart from the autumn term, but it shows that in the schools with the highest rates of free school meals, attendance is lowest. And you can see that in primary and secondary schools. And that's because parents in those schools are less likely to be able to work from home. Housing is more dense. You're much more likely to be in multi-generational households. So cases going up will have discriminatory effects. What we have to do is spread the vaccination, and the NHS is doing a marvellous job. The union is doing everything it can to support people in getting vaccinated, telling them when their age is ready, etc. We also have to make sure that mitigations are kept in place until the vaccine has really done the work that we needed to do. We wrote to Gavin Williamson this week, along with Unison and GMB, to say that we do think that masks should be reintroduced in secondary schools because cases are rising. We said that we think that vaccination of secondary school children should be undertaken as soon as a JCVI agrees that it's the right thing to do, and in-person staff meetings shouldn't be happening. We're concerned. We do think that lateral flow tests make a real useful contribution to finding some cases, but they are declining. We think the government should be doing more to encourage them. That's the end. We have our school COVID map. We'll tell you the cases around your school. Look at our website for more information on safety and education recovery. Thanks for watching. Please share.